Coming up, we will be on location at Cosmetic and Implant Dentistry of Maryland in Pikesville, Maryland, discussing advances in dentistry and how they can give you a beautiful and healthy smile with one of this area's top cosmetic dentists, Dr. Howard Rothschild. Dr. Rothschild graduated from the University of Maryland and is a fellow of the world-renowned Las Vegas Institute for Advanced Dental Studies. He has provided dental treatments for the Baltimore Colts football team and is a fellow of both the Academy of General Dentistry and the American College of Dentists. Welcome, Dr. Rothschild.
Good to be with you, sir.
Oh, it's our pleasure. We have a lot to talk about. We also have a patient, I understand, who's going to be joining us in a little bit. So let me just start right off the bat by asking you if you can please tell us about these latest advancements in dentistry.
Certainly some of the advancements have been in the equipment that we use or the techniques, both in the dental office and dental laboratory. And there have been quantum leaps in the improvement and the end result that we can obtain. We use CAD/CAM technology today so that we can fabricate a porcelain restoration for a single tooth, whether it be an inlay, veneer, or crown, in a single visit, which minimizes chair time for the patient and reduces the anesthetic event to one visit.
So that really makes it a lot more efficient. And so based on what you just described there, we're talking about technological advances that have certainly spearheaded this.
Oh yes, there are many more, and it's just increasing every day. It's so quick. We have the use of lasers, different types of lasers. We can use a laser for early detection of cavities. This particular laser will be accurate to about 93 to 95%. So we can get much earlier diagnosis, so it allows us to make a restoration much smaller and retaining much more natural tooth structure. We can use lasers to create a plastic surgery of the gingiva, if you will. You can imagine if you see a patient where the gum line on one tooth is at this level and another's down here and the next one's up here, it doesn't give you a nice harmonious appearance. Yes. And we can gently just recontour the tissue, usually with no anesthesia. And it's a much nicer smile effect. We can also use lasers for hard tissue surgery.
Based on what you just described, Dr. Rothschild, we're talking about not only advancements that can give us a more healthy mouth and smile and healthy teeth, but certainly a beautiful smile based on the porcelain veneers that you touched on in the beginning.
Certain fields have increased in their abilities dramatically, such as cosmetic, neuromuscular, and implant dentistry. Cosmetic dentistry has increased exponentially with the use of metal-free porcelain restorations. Having metal-free porcelain allows us to mimic nature in vitality and translucency.
Okay.
Older porcelain baked upon metal restorations were opaque looking, and a lot of patients always had this gray or dark line up at the gum line.
Yes, that's right.
With porcelain, that's all gone. We also can utilize Invisalign, invisible orthodontics for adults.
Yes. Busy professionals who don't want others to know they have braces that are straightening their teeth or lining their teeth.
You and I could be talking as we are today, and I could have Invisalign in my mouth, and you wouldn't even know it.
That is really quite an advancement now.
It's fabulous. Neuromuscular dentistry is another field where we can now treat patients who have migraine headaches, facial pain, earaches, neck pain, which are frequently due to malocclusion or a poor bite.
Now, most people wouldn't know that, doctor, that those types of pains are really caused off of what you just described.
Most people end up with the ENT doctor.
Yes.
And they have the CAT scans and the MRIs and all the ear tests, and they end up nothing is wrong with their ear. And frequently it's due to where the teeth are directing the lower jaw. So what we do with computerized jaw tracking and electromyograph studies, we can determine which muscles are hyperactive. We can see it on a computer screen and then determine in what position the lower jaw wants to be for those muscles to be at rest.
Very interesting.
And we take a bite and form an orthotic that fits over the lower teeth and trains the lower jaw to stay in a certain position. And sometimes we have to actually reconstruct the mouth to get this end result.
And what about dental implants, doctor? You had mentioned that as well. What are we looking at in that field?
I've been doing implants for like 30 years now, and the techniques today are so far removed from what they were 30 years ago. You can have a patient who has no lower teeth at all, and anyone with a full lower denture knows they're a dental cripple.
Yes.
And by inserting 2 to 4 dental implants, you can tie that denture down. They can eat anything. You can replace natural teeth with crowns on top of implants, so that it's basically like being like a shark. You just grew another set of teeth.
Yes, indeed, and change one's life in the process.
Oh, yes.
Talk about bringing confidence back.
No question about that.
We're now going to meet Kim, who's a patient of Dr. Rothschild. Welcome, Kim.
Thank you. It's a pleasure to be here.
Oh, it's our pleasure to have you. We always appreciate it when patients take the time in their busy schedules to come down and share their experiences for a few moments with us. Let me begin by asking you, what dental problems were you experiencing prior to coming to Dr. Rothschild? And if you were experiencing various dental problems, how they affected your life?
Well, I didn't have particular dental problems. I was in the restaurant business, and I was with the public regularly. And my teeth were straight, so I thought, and they were. And one day I took one look and I said, I wonder if there's something that I could do that can make me feel a bit more confident, because I was always in the public eye.
So in your particular case, it wasn't specific dental problems, it was more a lack of confidence because you didn't feel that you had that smile that obviously
makes
the
smile had to be the welcome to my customers, and I found myself a lot, smiling with.
So what did you have done, Kim?
I had 10 porcelain veneers of the restorations on the top. And what happened in the first process when I stopped in to see the dentist, Dr. Rothschild, he put a temporary in. I didn't understand it particularly. And he said, you'll see a big difference. And I'm thinking, okay, we'll see.
So it was like a test drive, so to speak.
It was a test drive. So he put temporaries in. I took one smile and I said, sign me up.
That was it. You loved them.
Loved them.
And how long did the procedure take?
2 visits. I think overall about 3 hours.
That's it?
That was it. And I'm terrified of dentistry.
Well, like so many folks, it's like death, taxes, and going to the dentist,
terrified.
Right?
And this was elective. This wasn't something that I had to have done. And with the confidence on what the results were going to be, based on what I saw with temporaries, I jumped in that chair with no problem.
Well, it sounds like you're very pleased with the results.
Completely pleased.
You look great. You've got a beaming smile. The confidence is back, right?
Thank you, it is.
Certainly sounds like it's changed your life.
Completely changed my life. Completely. I now smile ear to ear to total strangers, and I'm proud to have had it done.
Well, Kim, on that note, I certainly want to thank you for coming down and joining us and being a guest on A New Me.
I'll have to give you a big small goodbye.
All right. Well, thank you much.
My pleasure. Thank you.
We're now back with Dr. Rothschild. I must say, Kim seemed very pleased with the results, and you certainly have changed her life for the better. Look at that confidence she was beaming with.
Kim is a dynamite lady. That's number one. And she was a pleasure to work with. And we see this frequently with many patients, that this is something they want to do. It's not something that they have to do.
Yes.
And that makes a difference in the end result.
Now, we only have a few moments left, Dr. Rothschild, and I have to ask you before I let you go. Your organization has developed an esteemed reputation in the field of dentistry throughout Maryland. And I wanted to ask you, what sets you apart from the other dental practices?
I think what sets us apart is basically the cosmetic training that we've received, the hundreds of hours that we've taken with the Las Vegas Institute for Advanced Dental Studies. Our entire team has been trained at Las Vegas. The other thing that sets us apart, I feel, is our team. Yes. Everyone here is motivated, properly motivated, for the patient's welfare. We treat the patient as if the way we would like to be treated ourselves if we were the patient.
That's the way it should be, and that's the way it used to be, but unfortunately, over the years, with so many practices out there, it seems like they become more like it's a cattle call, as opposed to each individual patient being looked at and treated the way they deserve, with that individualized attention.
That's certainly true.
Well, on that note, I'd like to thank you, Dr. Rothschild, for joining us and being a guest on A New Me. It was certainly very informative.
Thank you very much.
It was our pleasure.